All right, everybody, welcome to today's virtual town hall on education here on the ABC15 Facebook page. Thank you so much for joining us. Certainly so much to talk about today, and I am joined by three local experts who are going to help address some of your concerns, answer some questions, and hopefully, give some great insight on what's going on as far as reopening schools and all of the challenges that come with it. I'm just going to start by introducing everybody first to my, here we go, right over here. That's Kate Wright. She is she's an associate superintendent at the Arizona Department of Education, and she was actually chair of the Roadmap to Reopening Arizona Schools Task Force. So thank you, Kate, for being with us. Right below her is Chuck Essex. He is the Director of Government Relations for the Arizona Association of School Business Officials. And then we also have Dr. Rachel Dethridge, right down here. She is a Phoenix area family physician, and she actually helped consult on the Madison School District's reopening plan. And so we have several people here who, again, will have some great insight. We want to keep this. We don't want to get political with this. The goal here is to give information, to talk about where we're at as far as reopening schools, and just hopefully arm, parents out there, families, teachers, staff with some more information, as so many of us are trying to figure out what's happening, what's going to happen, and families are having to make some tough decisions as far as their children's schooling. So just to kick us off here, I know I do see some comments already coming up on the right, so keep those comments coming on our Facebook page. Kate, though, just to start us off, I want to talk to you about, you were instrumental in this roadmap to reopening Arizona schools, this guidance that came out back in June from the state to help districts craft their reopening plans. Can you tell me a little bit about what went into that guidance and where we're at as a state right now as far as supporting districts as they get ready to reopen?
Sure. Thanks, Danielle. We noticed pretty early on that we were going to need to address, starting in May, sort of looking at what reopening schools would look like. Our focus this spring was really on distance learning. So how do we support schools where they are to finish the school year? And so we originally published distance learning guidance and then realized that through that process, schools need a lot more than just understanding how to implement distance learning. And so in May, we brought together a task force of over 85 practitioners, stakeholders. In fact, Chuck was part of our task force. We had school business officials, we had school board officials. We really tried to get a wide array of stakeholders to come to the table and think about what it's going to take to reopen Arizona schools in the fall. And that group had a very tight time frame. So we had 3 weeks to turn around the roadmap for reopening schools. We had 7 subcommittees. They worked diligently. They worked nights and weekends to get that guidance together. And by June 1st, we were able to publish the roadmap. And so it does include a lot of information of things that we thought were most important at the time, including health considerations and school finance, which Chuck can talk to this afternoon, which I think is really helpful. And in the end, what we've been talking about most recently is a month later, it feels almost like old news because so much has happened since we initiated that guidance. And so as far as where we are now, since then, there have been 2 additional governor executive orders. We're in the process of updating the roadmap to reflect both of those executive orders, one of which really provides that budget stability and flexibility for schools to offer different instructional models to meet the needs of their communities. And in addition, we've hosted at least 3 webinars with ASBA. We have one next week to walk through those executive orders. And we're working very closely with the Department of Health Services to supplement the health considerations that existed in the roadmap in June to build additional guidance and support for schools. And we're also working with the School Nurses Association to make guidance real and tangible and concrete in some of those places where we received feedback that additional information was needed.
Yeah, it's amazing how much of this is ever changing. You said that roadmap almost feels like it was so long ago just because of everything that's happened. And, you mentioned that executive order. Just a reminder to folks out there, Governor Doug Ducey delaying in-person instruction until at least August 17th at this point. We are seeing school districts saying they will start on time, but they'll have to do it remotely. And Chuck, I think that's where you have some great insight on, everything that these districts have to consider as far as when they start the school year and how they start the school year. Can you talk about some of those decisions that are happening right now and the factors that go into those decisions?
Sure, I'd be glad to do that. And I'd start out commenting how thankful school districts are for Superintendent Hoffman and the staff of the Department of Ed trying to work with school districts and work together to solve the problem that we're facing. This is I go back a long time, as people can see, and this is probably one of the most challenging, if not the most challenging time for school districts to open. Because we have the normal issues about low funding in Arizona. We're 48th out of all the 50 states, so we always open up school with limited resources. But now they're facing the problem with what do we do with students with the disease that seems to be growing quite rapidly and expanding quite rapidly in our state. School districts are worried about how many students will actually show up because schools are funded based upon the number of students that are enrolled in their school districts. They're worried about staff, how many teachers and other staff may not be able to come back to work for health reasons or concerns about their health. So it's a real challenging, and on top of all of that, Arizona is probably the first or one of the first states in the nation to open up their schools. Back in New Jersey and back east, they don't open up until after Labor Day. So you don't have any examples of what worked and what didn't work in other parts of the country. We're probably the pioneers in that. And it's a real challenge for districts, and everybody's trying to do the best they can to make it work, because you have, as people can attest to, severe issues with health that you normally don't have with the opening of school. And we still have the normal finance problems of not having enough money to do all the things that schools need to do.
Yeah, it's certainly a tough situation. And as you mentioned, so many eyes on Arizona right now for a variety of reasons. We were just named the global hotspot as far as coronavirus cases. We start school so early. So a lot of people looking to our state to see what we do and what happens as a result. I want to bring in one of the questions. This is from Amanda Harless. And she said, she understands that children don't get it as much as older people, but how do we know that they don't spread it just the same as everyone else? And I think that question encompasses what a lot of families, students, and staff are fearful of, is this, the spread of this virus in the school setting. Dr. Dethridge, you consulted on the Madison School District reopening plan. Can you talk a little bit about some of those conversations and some of the challenges that go into reopening schools from a health perspective?
Sure. First, I want to say, though, that it wasn't just me. There's many doctors and other healthcare professionals who have jumped in and helped with their local school boards. And I think that's a good resource to be tapped as we go forward, because we're parents too, and we care about our teachers and our kids and everybody getting back to school. So, in terms of coming back safely, there was a lot of considerations that went into what we as a group helped to advise our local school board on. And much of it was actually informed from the roadmap to return to school as well. I think there was a lot of good considerations in there, especially breaking it down health-wise into the amount of local spread. So it was broken down to scenario 1, 2, 3, and 4, 3 encompassing substantial community spread, which we're in right now, and scenario 4 also encompassing emergency closures. And so we used that along with the studies that we all found and researched, and were able to collaborate about best practices for coming back to school with limited resources. There is the guidance that says this is what you should do for schools. You should be social distance. You should find alternative schedules. You should have less kids in the classroom. That's wonderful, but is it achievable in Arizona right now with limited resources? So with that, our main goal was to say, if we can't do all of those things, what can we do? We can mask. And so we really pushed for universal masking at our schools within our district. And that is one thing that we did gain, which is great. And I know there's a lot of people who are fearful of masking. And I do want to reassure everyone that, one, the CDC already has guidelines about who should not be masked, those under 2, those who are physically unable to remove a mask, those who are unconscious, right? So there already are things where, yes, not everybody across the board should mask. 2, if you have a medical problem in which you cannot be masked, perhaps you're oxygen dependent, you are also likely not a person who should be out and about anyway. So those considerations are already there. But 3, people actually can wear masks, even small people, right? 5-year-olds can be taught to wear a mask. This is a behavioral issue, right, with being uncomfortable. It is uncomfortable. I want to acknowledge that. I wear masks all day long in clinic, right? And forever, surgeons have worn masks every day in surgery for hours at a time. It's something that we learn, and it's something our kids can learn. So that was our main focus when we advised our school board. And then the little details were also helpful from, again, the roadmap to reopening. The details of how do I implement this in the nurse's office we call them parent docs, have still helped to advise our local nursing staff in our schools of how should we implement this. And so I think as time goes on, we'll just find more and more things that we can all collaborate on.
Yeah, and just to piggyback off of what you said, Dr. Dethridge, we've seen in several districts as they're discussing these reopening plans, most of them are very honest when they say there are situations where social distancing, physical distancing in a school just is not possible. And I know, you had mentioned that masking is kind of that only line of defense at some points. And that's why we're seeing so many districts, move to the required masking.
And I do want to make the point that masking should not be done alone. We should do everything we can to achieve those other things. We should achieve the distancing. We should do all the hand washing, but also acknowledging at this moment in time, what can we do now?
Yes, absolutely. Another question from someone, and this is something we've been hearing a lot, Linda Naranjo, asking about what about those students who have IEPs or special needs. I was just speaking actually with a mom of 2 special needs students the other day, and they're really concerned about starting the year remotely and about getting services they need. Kate, I know in my previous discussions with Superintendent Hoffman and with the Department of Education that, she has mentioned that you guys are working on ways to accommodate all of the students out there as best you can. Can you talk a little bit about what's being done to help those students out there who do have IEPs or have special needs?
Sure, and we considered that student population very seriously in considering the roadmap for reopening schools. In the health group, we had representatives from special education, the school nurses, school counselors. In addition to school pathologists, we were really looking at our related service providers and asking what needs to happen if students return to school to ensure the care and safety for these students. And should students be unable to physically return to school, what needs to happen to ensure that that services continue to be provided. So our schools, I think, did the best that they could in the spring to continue to provide things like teletherapy and additional services that were available. That will continue should remote learning or distance learning be the option. And we know for the beginning of the school year, for many of our LEAs, that's going to be the case. Our local education agencies are starting before August 17th from a distance perspective. And I can assure you that the related service providers, I've been on several Zoom calls in the last week where that was a topic of discussion. They are prepared to work to meet the needs of these families, whether it's virtual through Zoom meetings or providing services the best that they can from a distance setting. And then in addition, the state was granted CARES funding as well to administer state-related needs. And part of that funding in our state set aside, $5 million, has been put aside for compensatory services. So we are prepared and understand that there will be a need once school resumes in person for services to be accelerated and enhanced, and we have accommodated for that with increased funding.
And I think we can probably all agree that this is in no way ideal. This is certainly not an ideal scenario for anybody going back to school, students, families, but that most, I would say everyone I've spoken with at least, are doing the best they can in an almost seemingly impossible situation at times. Would you agree with that, Kate?
100%. Yes, absolutely. Mm-hmm.
Yeah. And, you mentioned some of that CARES Act funding. Governor Ducey also talking about some of that funding going to help remote learning, especially now that so many districts will be starting the year remotely. There's a statement here from Vanessa Ivanish Lucy. I hope I said your last name correctly. And I think she encapsulates what a lot of people are feeling when she says, this isn't a one size fits all. We have kids who are pleading to go back. We have kids who are doing online learning. We have full-time working parents. We have single parents. There's so much that goes into this. And, Chuck, can you elaborate a little bit as far as, this idea that the districts are starting remotely and, what that means as far as school budgets, how they plan for the year, and why there's this debate of, okay, do we start on time online or do we start in person when we're allowed to, and just everything that hinges on that?
First thing I just want to say is that the problems with keeping distance between students starts even before they get to school. School opens up and people are familiar with seeing all those yellow buses running around their towns. Well, right now, to keep adequate distance between students on those buses, you'd probably only be able to have maybe 15, 20% or less of the students on each bus. So you'd either need a lot more school district buses or a lot more routes to even get kids to school. And the discussion about special needs students, many of those are on buses that have door delivery from their home to the school. So transportation is a problem even before kids get to school. But basically, we have about 1.1 million students in the state. They're in all kinds of different districts. They're in charter schools or whatever. And the funding, again, is based upon the number of students who actually are receiving services. To the governor's credit and Superintendent Hoffman's credit, they do have a provision for distance learning, which will provide more flexibility to school districts. But you need to have the resources and the staff to provide the services. And a lot of school districts, especially in rural areas, don't have the internet connections and don't have the technology available to provide online learning to their students. But I think most districts are realizing that they're probably going to have a variety of options to meet the different needs of parents and the different needs of students. But it's a real challenge to make sure that you have the resources to do all of those things that are new in many cases and weren't available to school districts in the past. So it's a question of, can you find the right mix of online distance learning and classes in brick and mortar schools to meet the needs of parents and students and of the education needs of students.
Yeah, it's certainly a huge task and a big undertaking. I do just want to address one comment. Kathleen Anderson saying that she hasn't heard anything about keeping the adults that work in schools safe. A little earlier in this Facebook Live, if you're just joining us, we did talk about the thought that went into crafting the reopening guidance with that in mind of keeping students and staff safe. And then Dr. Dethridge weighed in on the importance of masking and everything that's gone into some of those district plans regarding keeping students and staff safe. And I'd say, that's probably the biggest concern for everybody involved in this is keeping students and also staff safe. So I just wanted to make sure she knew that we are talking about that, and we did touch on that. Dr. Dethridge, as a family physician, you and I had spoken earlier this week about, you're really seeing kind of how this virus is impacting entire families. Can you give us some insight on what you're seeing in your particular practice?
Yes, and actually it was very nice that those of us docs who helped to advise our district were at all levels of care with COVID-19. So we were fortunate to have ICU doctors, inpatient doctors, ER doctors, and outpatient doctors like myself. So we were able to look at the whole gamut of things. But in my practice, it was very similar to what you would see in the community early on in March. You probably didn't know too many people who had COVID-19. We probably also weren't seeing too many people who had COVID-19 per one practice, right? As time has gone on, now I see entire families who have COVID-19, including children. I do want to acknowledge that there is encouraging data for children that, one, they don't get it as often, they probably don't transmit it as often, but that doesn't mean at all. And it doesn't mean that they don't get hospitalized. But we do tend to see less in the kids. But I do see entire families, grandmothers, parents, children, all of them at varying levels of sickness. And this is a very odd virus. Even though everybody can be exposed occasionally, there's one person who you would say definitely they would be sick in that household, and they're completely fine. So it's impacted people on the family level. And then beyond that, when you're missing this much work, people lose their jobs. People then lose their housing. What do we do about the kids then? So this isn't just an issue of people who are hospitalized, not an issue of, gosh, only 1% of us are going to get sick. People will be sick. People will be impacted. And I can't even imagine the people right now who've lost a loved one and who've have not been able to have funerals for them and grieve properly. As a family physician, we like to really think about the whole family and not just the particular illness. You should never be your illness, right? You are a person. And so I think that it's really hit our community at so many levels that we can't address in one discussion, obviously, but that people should be aware of. And we shouldn't be so cavalier and say, I'm probably going to be okay, because we should think about others around us and their extended families.
Sure. We were actually talking just before we started this Facebook Live of the teacher in Gila County who we learned passed away from COVID-19, Kimberly Bird. She was teaching an online course. She was in the same room as two other teachers. All three of them ended up getting it. And her family said, she did have asthma and she had some lung issues that made her particularly vulnerable, but that, they thought, okay, they're taking all the precautions. They said they wore masks, they were social distancing, they were using their own devices, and all three teachers still got it, and then Kimberly's whole family ended up getting it. And so just this idea of how quickly this can spread. And I appreciate, Dr. Dethridge, that you mentioned that yes, students do have that lower probability of getting it and transmitting it. Doesn't mean that they can't, but that there has to be concern for teachers and staff, their families, and everyone else who's affiliated with the school community. We've seen, Kate, we were chatting about this a little earlier. Superintendent Hoffman has certainly been a little more vocal these last couple of days regarding the need for more aggressive action from local leaders and also from the public as far as wearing masks and social distancing, washing hands. It really seems like there's a big push right now from the Department of Ed that we need to get this virus under control before we can safely reopen schools.
Agreed. And you're absolutely right. And that has been the message of Superintendent Hoffman. And I think it's a really important one. And it's the fact that reopening school in person is going to take ownership of the entire state, right? It is our responsibility statewide to start to slow the spread community-wide. Because at this point, when you are in a hotspot, when you have cases numbers increasing, and when you continue to look that we're on an upward trend of the disease, it's hard to see where we can put adults and students in a position where they will feel safe in an in-person setting. And so while I think it's really important to stress that we agree with the American Academy of Pediatrics statement about the fact that in-person school classrooms, that's the best place for kids to be. And there are so many resources that can only be provided when kids have access to school. At the same time, being able to bring a community together in a school building requires a different community spread that we currently have. And so it is the burden of changing that is all of ours. It's on the state. We really need to consider the actions that have been recommended by Dr. Christ and by Governor Ducey and take them seriously. And I really like Dr. Dethridge's point about the fact that we can't be cavalier and just assume it probably won't impact us, because right now that really limits the ability for us to consider in-person instruction.
Mm-hmm. Yeah, and we talk about these local conditions. Dr. Dethridge will bring you back in on this. Even with masks and hand cleaning, even with these precautions, you can still get infected. And some of it may depend on kind of your specific situation or kind of what's going on in your area, your community. Can you talk a little bit about that? Elaborate on that for us?
About local conditions in terms of your specific family or in terms of Phoenix currently?
Well, why don't we do both? Why don't we start by talking about kind of local conditions in Phoenix, and then we can hyper-localize to, an individual's family.
Sure. So, I mean, local conditions in Phoenix, it's no secret, are terrible right now. My colleagues in the hospitals are tired. They're extremely tired, and they're doing their best, and they're doing great care. But we need to acknowledge that this has been a huge marathon for them, and that they are literally begging the public to take a lot more responsibility right now, and thank the public who has taken great responsibility to limit this spread. So our local conditions are terrible, frankly. But I do want to say that in terms of when we talk about substantial spread, I do just have a definition from the CDC. Substantial community spread is defined as large-scale community transmission, healthcare staffing significantly impacted, and multiple cases within communal settings. I don't think anyone would argue that that's not what we're experiencing right now. And so I think that really should inform a lot of the decisions right now. I agree that the best place for children is in school in general. That's a huge generality. And everyone should look at their local conditions to help inform if that's okay at this moment in time. I look often at, and as many people do, AZDHS has a good dashboard that many people refer to. So when we're talking about not having school in to date, today, as far as they're updated, we've had in pediatric cases, they're saying less than 20 years old, over 12,000 pediatric cases. That's without school. In terms of hospitalizations, there was 86 hospitalizations so far, and very unfortunately, 8 deaths. And so if that is evidence that we are in uncharted territory, all of the studies that have been released from other countries thus far with restarting school have mainly been in areas much lower spread than what we have now. And additionally, they've been able to socially distance and other things. So this is just informational. We don't know what the future will hold. We don't know what will happen once we open schools. But that is the end goal. We want to get kids back, but is now the right time, right? Sure. In terms of the family, everybody's family's local conditions are different. You may have people who work outside the home and no one who can stay home with the kids. That's a reality. I'm sure that families are relying on their older children right now, and then older relatives who we would love to keep isolated but can't. And now they're looking after younger members of the family and may become subsequently exposed that way. I personally have had patients of mine been exposed that way. And so again, I want to acknowledge that it's really tough, and not one decision for one family is what's going to work for another family. But then we also have to look at it in the context of Phoenix, of what do we need to do at this point to get these numbers down so that we can open up our schools.
Mm-hmm. And, when you say that, it looks different for each family, because each family's conditions are different. So what works for one may not work for another. Chuck, that's very similar for the districts as well. So even though we have this state guidance and CDC guidance that, school districts at the end of the day are hyper local. They're making decisions based on what's best for their particular community. So you might have, certain things look different in a district like Mesa, where you have 60,000 students versus a rural community or a smaller district. Can you talk a little bit about how that setup and kind of how districts are making their decisions right now?
Well, the first thing, the system we have and the laws that now exist on funding schools basically are on a traditional model where kids came to school in the morning, stayed there all day long, and went home in the afternoon in a brick and mortar school. That was probably 95% or more students. There were a few then in online programs. So the law is very inflexible because it's modeled after that particular way of delivering services. We need, and I know the reopening of school task force saw the need for as much flexibility as we can get in the system, because things not only are they different, extremely different than they were in the past, they're different for different areas of the state. What might be happening in Yuma may be different than what's happening out in Stafford at a particular time, depending on how the disease is progressing. What happens in the reservation schools up in the north and other areas of the state. So we need flexibility in how the formula works, because it doesn't do schools any good to develop all these alternative ways of serving students unless the state funding formula provides funding for those services. So flexibility is the biggest thing and the most important thing to get in the formula. And we need that not only on different options available, but allow for change during the year. Right now, schools are scheduled to open on August 17th. They may not. They may. They may open up and close again on November 1st or whatever. So whatever the state can do, and we appreciate Superintendent Hoffman and the Department of Ed taking that charge to try and provide all the flexibility that they can so districts can work with parents and deliver the kinds of services that work in the homes of their students, but they need to have the flexibility. They can't do something that the state is not willing to fund because schools depend on state funding for their budgets to operate.
Sure. And you mentioned that flexibility, and we saw some of that added support for additional remote learning. I know a lot of parents and families, their experience with the kind of emergency distance learning that happened when schools closed unexpectedly, ideally will be different than the remote learning that they will receive at the beginning of the year. I know a lot of districts have been trying to be very clear about that, okay, we've had some time, we've surveyed our families and our teachers, what works, what didn't work. So the idea is that even though we're starting online, that it'll look and feel different than kind of that emergency remote learning that they had to switch to with really no notice back at the end of last school year. Lucy Anaya Mitchell brings up a good point. We touched on this a little earlier. Not sure if anyone's already addressed this, but with a teacher shortage, where do you find substitute teachers if and when a teacher is out with COVID? And she says, I can't imagine anyone willing to step into a COVID positive classroom. But that idea of these underlying issues that we had before, funding issues and teacher shortage, I mean, Kate, that certainly just complicates an already difficult process.
Absolutely. And we spent a lot of time talking about that in planning considerations for teachers and leaders within the roadmap. And without even getting down the road to talking about substitutes, we were talking about several of our LEAs that have emergency certified teachers or teachers who haven't received all of the essential training to be confident in their instructional practices, then switching to an entirely different instructional model, which really even experienced teachers don't have experience with in an online setting or in a distance setting. And so we know that the teacher shortage and lack of adequate funding for teachers, it's a challenge in the best of circumstances. It's beyond challenging when your circumstances become less than ideal, as you mentioned. And now we have unprepared teachers that don't have the training that they need. We've experienced teachers that they themselves need additional training and support. And to the question's point, if schools were short of substitute teachers before, at this point, you're not going to find substitute teachers. And I mean, even I think the willingness aside, just that we just don't have the numbers, right? So that is a significant concern of returning into a physical classroom setting, is the worry of having adults in a position where they can provide consistent and effective instruction.
Yeah, it's one of several additional issues that, again, just complicates this whole process and of knowing when is it okay to reopen schools. It's so difficult with all of these other factors. And Dr. Dethridge, you mentioned wanting to address COVID positive classrooms in a masked versus an unmasked classroom.
Right. And so the point being that people are very concerned about going into a COVID positive classroom, and that being very dependent on who is COVID positive and are they masked or unmasked and who was exposed. So, for example, in the healthcare setting, when both parties, the source and the recipient, are both masked, the risk of contracting the disease are much lower than if certainly the source is unmasked. That's going to be your highest risk. But so when we're talking about somebody who has a child, at least a student who has COVID in a classroom, that when you're completely masked in a classroom, the risks go so much further down. And so just to make the point that masking is so important in the classrooms, not just right now during substantial spread, but as time goes on and we're still in this, even at low spread.
And you mentioned, you explained a little bit that substantial spread and gave the definition of that, which was very helpful. This is a loaded question. I don't expect you to have the answer, Dr. Dethridge, but I think everyone's looking for a benchmark. When we hit X amount of cases, or when we hit this level or this phase, we can reopen schools. From a health perspective, is there anything like that at this point, or is it literally just we're just going to take this a day at a time and hopefully get out of that substantial spread and then reevaluate?
Right. There is no benchmark right now that I'm aware of. There is quite a bit of new observational data of kids who have been COVID positive in other countries who have been in classrooms and not spread it or minimally spread it. So that's where a lot of the thought of well, kids can't spread it. It's not that they can't. It's that it seems to be at lower amounts. It doesn't seem to be as readily spread to them or as readily infective for them. So it's much lower, but it's not non-existent. So I just want to address both things. It's not an extreme, right? But there is no benchmark. And in fact, many of us physicians who were advising our school board, we actually sent a letter to Superintendent Hoffman asking about metrics specifically of what is the metric when we should close schools? What is the metric when we should open them? Should we even have a metric? Is this a moving target?
Okay, I was just going to say, we had that conversation yesterday with the DHS task force for reopening schools, and they did reach out to the CDC to see if there were any discussion around metrics, as well as their Western state partners. And we, as an agency, reached out to the Council for Chief State School Officers, which is our partner, our national partner in thinking through things, challenging things like this. And I can say, at this point, there are no other states that are publishing metrics or specific numbers. And there has been some conversation around just the fact that there's not enough data yet to determine specific numbers. And to your point, Dr. Dethridge, the concern of, is it a moving target, right? Is it something that will be constantly shifting and changing and forcing school leaders to make reflexive and reactive decisions across the school year as things ebb and flow? And what are the additional challenges if we create that kind of level of metrics? But 100% understood. And actually, I'm incredibly grateful that you're talking about the scenarios, because when we built them and we used language like minimal or substantial, we understood that they were, vague and kind of undefined. And the fact that you defined it is very helpful. And even at that time, there was sort of a push, like, should we put case numbers on it? And it's just the challenge right now. I think we understand the want for that. And what we understand from our healthcare partners is just the challenge in having data to really put concrete numbers in place.
And when you say, kind of a moving target, or, it just reminds me again that all of this is so fluid and things are changing so quickly. I mean, even this week, we heard Monday that supposedly new CDC guidelines for schools were coming out next week. And then this morning they're saying, no, they're not going to be new guidelines. It's just this constant, almost like stepping, forward and back at the same time. And Chuck, from a planning perspective for a district, a lot of this, so much relies on their budgets and their financial planning. You have teacher contracts, you have, the academic calendar. I mean, how are you guys kind of advising your members as to how to cope with this constant unknown, essentially?
Well, the unknowns are making it that much more difficult. Districts have another big challenge. Even before we have a COVID-19 world to deal with, we have the largest class sizes in the country. So as we address the issue of providing adequate space for students in the classroom, it's more difficult for Arizona schools than it may be across the country, because we already had the largest number of students in each of those classrooms. And we always had a teacher shortage even before COVID-19 was a challenge that was facing. So not only are districts worried about the funding that they're going to receive to make sure they can do all the things that people want, we have the problem with we couldn't open up school with every student in every class and be anywhere close to meeting the distance guidelines that are being advised and are being recommended. So districts that will have that problem, at least the governor and the superintendent have done some things to assure school districts that you have a certain level of funding. If a large number of students don't show up, you can still have a base of funding that you can count on. And districts are trying to be creative. There are some districts that are bringing students in the morning and another group of students in the afternoon for each day. There's some that have students coming on Mondays and Wednesdays and getting distance learning. So I can't stress it enough. We're just going to have that flexibility. And not only that, the flexibility to change, because it may be different 3 or 4 or maybe 5 or 6 different times during the year. You'll have a different set of rules that you have to operate on, and you need to have the flexibility to move as the virus changes.
Mm-hmm.
Well, we have some more comments and questions coming in on the side. Misty Hernandez asking, when a child or a student tests positive in the classroom, doesn't that mean the whole class has to quarantine? Dr. Dethridge, you touched on that a little earlier regarding, were both parties wearing masks, was one party wearing masks? A lot of this comes down to people concerned over district protocols and what is the protocol going to be when someone in a classroom on campus tests positive. And Kate, I think I heard during the Scottsdale Unified Governing Board meeting earlier this week, their superintendent mentioned that you guys were working with the Arizona Health Department on kind of trying to get some better guidance for districts as far as protocols on what to happen. Is that in the works right now?
It is, and I saw a draft of that document yesterday. And they have outlined the difference between isolation and quarantine, and defined some parameters very specific to what quarantine looks like, what to do exactly in the case that was mentioned, in addition to what to do if a student is symptomatic within the school day, and that's the isolation portion, and then what it looks like to indicate quarantining. So I anticipate that we will be updating our roadmap in the next very short time. We meet again on Friday, so we are meeting twice a week to go through their supplemental guidance and be able to release that as soon as possible.
Okay, great. Yeah, I know that's something that a lot of, not just districts, but a lot of families also are curious about, teachers, students, et cetera. One other thing that I want to make sure that we touch on is the fact that, with school starting remotely, all the challenges that come with remote learning, as far as the digital divide that we have in our state, with some students really not even having access to reliable internet. That's obviously a big concern. And so, Kate, I'll bring you back in on this one. I know the superintendent has a technology task force, and I know she's aware of this issue. We've talked about it several times, and that she's very concerned about that. What sorts of, what's happening on the state level to try to bridge some of that divide?
So I know that you're aware that there was funding as well from the governor's office in regards to the digital divide, and that's something that we're working with the governor's office on. And as far as the technology task force, that group is meeting, has met twice so far, and they're spending a lot of time talking about the needs within our districts. Something that came up just in the last week is this idea that potentially access is a greater issue than device. So our LEAs seem to be able to find the ability to pay for or to acquire devices for their students, even in our schools where we have a high free reduced lunch situation. They have very creatively been able to find ways to provide devices. So the issue we've been talking more about is this issue of access and equity of access across the state. And the superintendent has an additional group of stakeholders that she's been meeting with that have had some very creative ideas around working with the internet providers, using community outreach teams to work with families to access the $10 a month internet access that some of our providers have been making available, leveraging potentially some state voice to encourage an extension of those kinds of programs. So she is very actively engaged with the community and with our local business partners in really solving the access issues so that our students across the state have access to the internet that they need. And because I think Chuck brought up a really important point, when we say distance learning, the reason we don't say online learning is because that's not an accurate picture of what it looks like for all of our students. And so there are several There are many students that when we start the school year, they won't have access to even instruction on their computers or in a virtual space. They will potentially be receiving packets and things like that. And so we really need to think about what distance learning looks like and the equity of that across the state. And I think that's where the access piece comes in. And Superintendent Hoffman has been a tremendous advocate for looking at all of those solutions and bringing the right people to the table to get those. What we're really looking at is to getting some of those models in place where people are being successful and helping our other state partners understand how to replicate those things in their communities.
Yeah, and just one more point that I want to make sure that we touch on, because I see it coming down in some of the questions, and I've personally been asked this several times by some of our viewers. This kind of debate over, a student's physical safety, but also taking into account their social emotional well-being. And Dr. Dethridge, I know you kind of touched on this a little earlier when you said, yes, kids do better in school. No one's debating that, but it's a matter of when it is safe to do so. And can you just elaborate on that a little more about kind of what you're seeing as far as families being impacted by this, kids, not just on a physical level, but maybe also a social emotional level as well?
Sure. Yeah. And kids definitely are. I'm fortunate enough to work in an FQHC, a federally qualified healthcare center, where we do have what we call wraparound care. So we have access to counselors and a psychiatry team and nutritionists. And so people feel very comfortable coming to us with a lot of different issues. And so for adults and kids, and I would say definitely, especially that middle school age, I've seen an increase in anxiety complaints for almost all of those age groups. Definitely an increase in depressive type symptoms as well across all of the age groups. It seems like the little kids in general are faring a little bit better, but also sometimes driving their parents a little crazy. But it is there, and that's with a child who doesn't have any other underlying issues, who may need extra services from the school. So now that they're deprived of that, of extra therapies, whether it is from socialization or speech therapy or what have you, that's going to create a lot of trauma across the spectrum for our kids. And so coming back to school and focusing on social emotional health for kids is a key component. It's addressed with the AAP as well. And so I think doctors in general are right in line with the teachers with this and the Board of Education and everyone, that it's so important to have the social emotional health component, even from a distance, right? How can we start bringing that into their homes now?
Well, I cannot thank all of you enough for being part of this town hall with me and for addressing all of these questions and comments. I really appreciate your insight and your time and your information. Before we sign off here on our Facebook Live, I just want to give each of you, one last opportunity to, comment on kind of the situation we're in right now and the challenges and what's going on with trying to safely reopen schools. Kate, since you're right next to me, I'll go ahead and start with you.
I think that what we really want to emphasize is that the priority is of course getting students back into school, and yet the need for that to be able to happen is a personal responsibility of all of us as Arizonans. And so we are really asking the state to step up, to take responsibility, to wear their masks, to practice all of the mitigation strategies that we know help, so that we can start to improve our public health, to turn our cases onto a downward trend, so that we're in a position to safely consider bringing both students and teachers and bus drivers and lunch workers, to be bringing everyone safely back into a school setting, because we know that's our job, that's our business. Education is our business. I don't think there's much more important to an effective functioning society than the ability to be able to educate and serve our students. But at this point, with the cases as they are, we are asking the state to really take responsibility and help us to be able to be in a public health situation where having students in school and bringing adults back into school is something we can safely consider.
Some great points there. Thank you, Kate. And Chuck, I'll go ahead and turn it over to you.
Schools want to have a safe, healthy environment for students to come to school and learn. and hopefully sometime down the road that will be there. But right now, there's a lot of issues and a lot of concerns, and you really have to have the flexibility to meet the changing times. So we need to allow schools the flexibility to provide all the different options. There are some schools that we're talking about having half of their students come in the morning. They would take work home in the afternoon. Another group would come in the afternoon, and they would be given work to do the next morning. Our funding formula needs to allow all of those innovative options until we get to the point where students and teachers and staff can return to schools and be healthy and be safe in that environment. So I can't say it enough. They need flexibility in this changing world so that districts can do what's needed to meet the needs of parents and students.
All right. And Dr. Dethridge, before we go, I'll turn it over to you.
And I want to acknowledge for everyone that this is not easy. There is no easy way out of this for anyone. It will be hard and it will continue to be hard. And we need to give each other grace in Arizona and space to, it's okay to be angry that we're still in this right now. I hear of that from a lot of patients that they're just tired of being in this pandemic, and we all are. So let's all take responsibility. Wear your mask when in public, period. Distance as much as you can. And if you're around somebody who's not wearing a mask, the best thing you can do is physically distance yourself from them. And let's all, as adults, be good examples for our kids so that it can be reassuring for them and so that they can understand the world that they're living in.
All right, some great insight, some great points. Thank you again so much to all of you, not just those of you who are commenting and watching via Facebook, but to our panel here. Thank you so much again for your time. It is so greatly appreciated. Also want to direct people, in case you missed this entire town hall, we've been going, we're getting close to an hour now. So there's been a lot of information discussed, a lot of topics discussed, several of the questions popping up right now we have addressed earlier in the Facebook Live. So this will be up abc15.com/town hall. That's where you can find the Facebook Live right there at the bottom of your screen. And then also I had mentioned that we are tracking a lot of the district reopening plans. We're doing our best to help people access that information and keep you posted on when governing boards are meeting and making their decisions. And so Cortland, you can't see him, but he's the tech guru behind all of this. He's created a great map too, where you can actually go pick your district and a little info box will pop up. And that's at abc15.com/schools. So again, thank you to our panel. Thank you so much to those of you watching, and surely much more to come on the topic of education and reopening schools. But for now, we'll say goodbye and thank you.
Thank you.
Thanks for the opportunity. Appreciate it.